The Vibe at Vibe is sponsored video content brought to you by MedCity News.
Hello, I'm Arundhati Parmar, Editor-in-Chief of MedCity News. Today I have with me Dr. Stanley Crittenden, Chief Medical Officer of Quantum Health. So Stanley, pharmacy management is a critical issue in the healthcare space. And how is Quantum Health sort of addressing the costs associated with specialty medications? You know, those are super high.
Yeah, thank you for that question. So, as you know, we're in the golden age of medicine nowadays, and as a physician, I'm super excited about that. We have so many new tools and drugs in our toolbox that when I started practicing, we didn't have it. And so it's a great time for our patients to really get top-notch care. Just a few stats I want to talk about. In 2024 alone, 50 new specialty drugs were approved. In 2023, there was 55 specialty drugs approved. Wow. And as you can see, specialty drugs are kind of the thing now. And as we think about the challenges of specialty drugs, they oftentimes come with high cost. And it's really hard for both providers, of course members, and also plans and plan sponsors like employers to really keep up with kind of these changing trends in cost. And it's also really hard for us to keep up with the quality outcomes of these drugs. So at Quantum, we are really laser focused on making sure our members and our providers are receiving the latest and greatest information and technology as it relates to specialty drugs. There are a few different techniques we use in order to help our employers really start to get a sense of specialty drugs and how to navigate through them. We have in-house pharmacy and clinical teams that really dive into specialty drugs from the microscopic and the macroscopic sense. We have two really interesting programs or paradigms at Quantum. One of them is our utilization management processes. This is where all of our medications that are on the on the medical benefit side are run through our pharmacy and clinical teams. And so we compare to make sure the medications are meeting indication, the right dose, right setting. And this just makes sure our members get the right drug at the right time, right place. And then adding on top of that, we do what's called site of care. Site of care is really exciting because our members now have a clinical team that includes nurses and pharmacists really taking a look at some of these specialty drugs and where they're infused or where they're given. Specialty drugs are oftentimes, again, they're oftentimes injectables that can't be necessarily given in the comfort of a home historically, but a lot of the newer formulations can be given in settings outside of the clinical hospital setting. And so our team reviews criteria sets to make sure members are getting the drug at the right place. This is exciting because I'll give you a story. One of our members is an engineer and he had Crohn's disease, and so he's taken Entyvio and he was having to go into the hospital every month or so to get an injection. We're able to actually move that med to the home. And so now the member can actually get the care he needs in the comfort of his home. That of course leads to better clinical outcomes because now we're getting the member right time, right place, right drug, but also the cost of administering the drug in the home is a lot cheaper.
Stanley, GLP-1 medication are transforming obesity treatment and weight management. What key challenges do you think employers are facing in managing the demand for these drugs?
Another really great question. So as I mentioned earlier, we're in the golden age of medications, and one of those medications that are in our golden age are GLP-1's. Just a quick little primer on GLP-1's. GLP-1 stands for glucagon-like peptide. These are really powerful drugs that were initially developed for the treatment of diabetes, but now we've seen really good efficacy for other conditions, notably weight loss, but they also have efficacy for other clinical conditions like heart failure, kidney disease, even certain types of liver disease. But as we have any of these new drugs on the market, clearly cost comes into play. At Quantum, we are helping our employers think through strategies around how to mitigate cost, but at the same time while improving clinical quality for this really unique set of drugs. Again, I'm really excited about GLP-1s because it gives us another tool in our toolbox for members that hadn't had really a good treatment option for treating obesity. And just a few stats about obesity. Obesity is clearly a chronic disease as recognized by the CDC, World Health Organization, and the AMA. And obesity is related to a lot of other complex chronic medical conditions like heart disease and kidney disease. So clearly we want to make sure we're treating kidney disease and kidney failure. And again, having this tool in our toolbox, we want to make sure we're using it responsibly and at the right time for our members. And so as employers are diving into thinking about how to cover GLP-1s, we make sure that we are equipping them with the right information so they can make the right benefit choices about GLP-1s. We know that oftentimes a member just isn't a pill or just a drug. They are the combination of lifestyle, health coaching, diet, exercise, other wellness. And so we combine all of those into one package to make sure we're helping our employers really think through and consider the ramifications of covering these drugs. We know that our members actually want these drugs too. In fact, there was a survey done last year that showed us about 66% of members would actually move jobs in order to get GLP-1 coverage. And so that actually shows that these drugs are really wanted by members, and they are actually a really great tool in our toolbox to actually treat obesity and their underlying medical conditions.
Let's address some recent news. Your competitor Accolade was just taken private by a smaller company that sells to self-insured employers, Transcarent. I'm saying taken private. They've shown their intent to take that company private. I guess the question is, they will get certain synergies when they combine. How does it impact Quantum Health?
This news is exciting for the industry. The industry recognizes that navigation is an important feature. Employers really depend on trusted navigation partners to help them with these complex challenges around healthcare for their members. And I think this acquisition puts some wind at the sails of all of us navigators. But our model at Quantum is actually quite unique. Quantum was built 25 years ago purposefully around really connecting the broader ecosystem of members, providers, and their employers into one single solution. And again, we've been doing this for 25 years, and we've really perfected some of these really important nuances. As employers become more and more sophisticated, especially around navigation, given that they really need it to be successful in their health plans, they're looking for partners who are tried and true and tested, especially around some of these really complex challenges. And again, being purpose-built to be that single point of contact really is our differentiator. Another really unique differentiator of Quantum is that we own all of our utilization management in-house. We see that as an important part of our clinical model. At Quantum, utilization management interfaces with our care management teams. And so an example would be if a provider is putting in a request for a PET scan, for example, we now know that member is on a cancer journey. Before, that PET scan would have gone into a siloed workflow. We actually, by owning that, can take that PET scan information, connect the dots, ensure our members are connected to the right clinical resources earlier on in their course. And so owning that utilization management piece and having it not be an afterthought is a really, really powerful value driver. So now our members are connected generally 120, 160 days sometimes before the first claim even hits, because now we are upstream owning that navigation and connecting them across our ecosystem. And so again, as employers and plan sponsors become more sophisticated, they understand the power of navigation, and again, being connected in that one single point, driving members across utilization management, case management, health and wellness, and even other complex conditions is, I think, really what sets us apart from some of our other navigator competitors. And again, we want to make sure our members and our employers are getting that value from that whole person experience.